and thank you to Charles St-Pierre and the Quebec HAE Patient Organization for this opportunity to update you on the work of CHAEN, Canada's HAE Physician Network. CHAEN is an organization of physicians who treat and/or are interested in hereditary angioedema. It's a nonprofit association composed of physicians from across the country. Its roots go back to the early 2000s when interested physicians came together to develop guidelines. The vision of CHAEN is to enable HAE patients in Canada to receive appropriate support and care so that they are able to lead full lives. Our mission is to unite physicians who are committed to ensuring HAE patients in Canada have access to excellent care that reflects current management and treatment guidelines, and to work to promote research and education. Our board of directors includes physicians from coast to coast, including, importantly, from Quebec, Dr. Jacques Hébert and Dr. Hugo Chapdelaine. We have physicians in almost every province, with the exception of Prince Edward Island, including 9 treaters from the province of Quebec. And now over to you, Dr. Betschel.
Thank you, Peter. Thank you for providing that introduction on CHAEN. What I'd like to do is talk about some of the committees and some of the work we've been doing specifically. But first, I'd like to acknowledge that the work that we do, we really do ride on the coattails of those who've come before us, both internationally and in Canada. And because it's a Canadian meeting, I do want to highlight some of the key contributions Canadians have made and first ofs moving forward. William Osler, really the father of modern medicine, was Canadian, born in Bondhead in Ontario, and went on to describe the first familial association with angioedema back in 1888, commemorated here on with a stamp like Canada Post. What's also interesting, and many who may not realize, that Dr. Spalding, who practiced in Toronto back in the 1960s, was the first person to use steroids, anabolic steroids, to treat patients with hereditary angioedema. It wasn't the clinical trial, but it was the first publication where it was used to control symptoms with HAE. Certainly a therapy we're moving away from as we move forward. The other key contribution in this publication, and you won't be able to see it unfortunately because the typing is quite small, but he was the first one to advocate moving it away from and referring to it as angioneurotic edema. And it was initially referred to as angioneurotic as it was thought that the angioedema was related to problems with the way the nerves penetrated into the blood vessels. But around that time, in the psychiatric literature, neuroses was becoming a common term. And so there was a confusion around angioneurotic edema, thinking that people may be having these attacks because of neuroses. Another key contribution by a Canadian, Dr. Karen Binkley, she was the first to publish, along with Conrad Bork very closely in another journal, the mutation that was responsible for hereditary angioedema type 3 or hereditary angioedema normal. Key committees in CHAEN that are focused on disseminating knowledge, as Peter has outlined so far. I'll just take you through some of the work that this organization has done, focusing on guidelines, research, and laboratory. So with respect to guidelines, again, first, so Dr. Tom Bowen, who was my mentor and who was the lead in CHAEN before I took over several years ago, really brought people together, both within Canada and internationally, to come up with the first Canadian international consensus algorithm on the diagnosis, therapy, and the management of hereditary angioedema. Since then, there have been numerous iterations of international guidelines. Most recently, one that I was fortunate enough to be part of, published in 2019, the International Canadian Hereditary Angioedema Guideline, including all the members that Peter alluded to, as well as international members, but most importantly, patient representation, both with HAE Canada and with AOHQ. And HAE International were involved in this guideline development. And I just put this up. This was the last guideline that was published, and I promise that it will not be long before the guideline, the most recent iteration, will be translated into French and made available on our website for everyone to have access to. Now, what about research? And the areas have focused largely on quality of life and knowledge translation. So with respect to quality of life, I want a big thank you to members of the Quebec Patient Organization, AOHQ, in terms of their contribution, essential to involve the patients, and you are very eager to get involved very early on. This has led to 2 recent studies, so both in this year, and using a validated HAE-specific quality of life instrument to look at the quality of life in patients with hereditary angioedema in Canada. I would encourage people to look at this. I think it really did shed some important light that even though we have access to good treatments, there are still areas where we can improve in terms of improving patients' quality of life. Another publication that followed shortly after that was part of the same overall research was really looking at the demographics and the clinical characteristics of patients with hereditary angioedema in Canada. And that too is very informative reading for those of us who live in Canada to see how we compare internationally to some of the other studies. So I draw your attention to those. What about knowledge translation? This was a study that was published last year. It was one that was done with our research committee and really focused on how we might be able to develop a tool to help emergency rooms where we know patients with HAE present to, certainly before diagnosis, to help guide them, to triage them, make them think that this could be HAE with a very simple number of questions, and then direct them to the specialist who ultimately would make the diagnosis and then facilitate access to appropriate treatment and care plans. Lastly, the laboratory committee, this was work that was conducted by the committee, but spearheaded by a graduate student at the time in Quebec City. And it looked at the diagnosis of hereditary angioedema with C1 inhibitor deficiency. And this was a survey of Canadian physicians and laboratories, really so we could understand the landscape of the tests that were available, perhaps discrepancies across the country with respect to access or funding of those tests. That was done some time ago, and we hope to address this as we move forward. So those are some of the essential committee endeavors that we've had over the past several years. And I would like to turn it now back to Peter to talk about advocacy and the future years with CHAEN.
Thank you, Stephen. Among the other areas that CHAEN is heavily involved in is advocacy. And this involves dealing with the federal government and Health Canada, also the various provincial governments, including the Ministry of Health and Social Services in Quebec, dealing with HEMA Quebec, dealing with Canada Blood Services, and dealing with the National Advisory Committee on Blood and Blood Products. The kinds of issues that we deal with are the approval of new treatments that are being brought into Canada and need approval. And then after they're approved, of course, we have to ensure that they are available in all the provinces across Canada, and that there is appropriate coverage from insurance, the insurance point of view, so that patients can access those treatments. Currently, we are dealing with access to Tax Zero in Quebec, and we'll be working with the Quebec Patient Organization on this important issue. CHAEN's website is fully bilingual, and it has a number of really important resources available to patients. So I invite you to visit our website. You will see under the resources for patients that we list all the physicians who are treating HAE patients. So you can refer those names to your family physician to get access. As well, we also have published various guidelines on treatment over the years. Those are available there, as well as summaries of all of the HAE literature that has been published, and we update this on an annual basis. In terms of CHAEN's future over the next 5 years, we foresee undertaking a review of our guideline, because this is required to be reviewed on a regular basis to ensure that it is up to date, and so that it is taken as a valid piece of evidence that should be used by governments when they're making decisions about treatment and care and access to various medications. We're continuing our work to ensure that HAE care and referral algorithms are incorporated into emergency rooms across Canada, so that when patients are coming to emergency rooms, that they're getting the care they need. We have conducted various studies on, as has been mentioned, on quality of life, and as well as the physician treater surveys. So we're going to be looking at updating those surveys on a regular basis. And when we do, especially with the quality of life survey, we will once again look to Quebec's HAE patient organization to help us disseminate, and we really appreciate your participation. The more people who participate, the better the information we have. We're also going to repeat our laboratory study on the kinds of laboratory examinations that are available and in what jurisdiction. We're going to look at the treatment outcomes for women who have received HAE treatments while pregnant, and that will likely lead to a study that we will publish. And we're also going to look at the very important issue of establishing a patient registry across Canada, because that will be a really effective tool in terms of enabling us to have even more access to information that we can provide to governments and back to you, the patients. So thank you very much. It's been a wonderful opportunity to share some information with you, and we look forward to being able to come back in person to your wonderful conferences in Quebec.